Is this thing still on?
I think they can hear us a bit better now. Should we keep talking?
Of course. Let's say it louder for those in the back. Hi, and welcome to the Green Nurse Podcast, an unfiltered discussion about health and healthcare. My name is Amie Archibald-Varley,
And my name is Sara Fung.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, YouTube, iHeartRadio, or any other podcast platform, don't forget to hit subscribe so you can get updates on new episodes.
If you love our podcast and our advocacy work, please go to www.grittynurse.com and click on the Support Us button. This will give you access to exclusive episodes and early releases on a monthly basis.
This will help us with the cost of running the podcast, the time and energy to put out awesome and informative episodes. And for that, we thank you and we appreciate you. All right, welcome back, everyone, and thank you for tuning into the Grading Nurse podcast. We have a interesting topic today. We're actually going to be talking about nursing school. Dun dun dun.
Yeah.
And I don't know why we haven't covered this in more detail before. Like, we've talked about why we got into nursing and little tidbits about clinicals, but we've never really talked about our experience with nursing school. So, Amie, do you want to tell us a little bit about your initial thoughts on this topic?
Maybe I didn't, but I think I did talk about like my journey into nursing school wasn't exactly a straight line. I actually envisioned myself as like a news weather girl, then scratch that, and then I was like, oh, I want to be a child and youth worker, and I did one semester, and I was like, fuck this shit. I was like, no, I can't. Like these badass kids, no. Actually, I did one semester, and I just figured that like it just wasn't. I didn't feel like I had fit into that spot, that situation, and I had previously had my grandpa who was sick before that, and I just felt that I should have followed my heart and went into healthcare.
Hmm.
So I did, but again, like I said, it wasn't a straight line. And but when I think about nursing school, like I think there's so many cliches and memes, and we've seen all the various different memes about nursing school. It is really awful. I don't know what else to say. I just remember I remember my last year being fun, but year 1 through 3 was somewhat disastrous. And I think it was just it was coursework, theoretical, very, very heavy, and then the integration of clinical. That's kind of like my bird's eye view of my nursing school experience. Not saying that there weren't some fun times, because there was absolutely some really funny times, and I hope we can touch on some of that today. But from a bird's eye view, it was kind of a nightmare. It was like high school all over again.
Yeah, my journey was a little different. So I went straight into nursing school from high school. So I was 18 when I started nursing school and really naive. I had moved away to attend nursing school. So it was not just a new environment, but, being on your own for the first time. There's a lot of freedom with that. And now nobody's
Right.
looking over your shoulder to see that you're studying and going to your classes and all of that. I really felt like a fish out of water. And my really only experience with healthcare up until that point was I used to volunteer at a hospital. So I don't know if you remember back in high school, we had to complete the 40 hours of community service.
I did not. I did OAC, so I
Oh,
didn't.
so I was the first year that had to do that. So I had to do 40 hours of community service and I did it at a hospital. But my only role really was to hand out ice water to patients. But at least it brought me into the hospital. I got up and close with patients. I got to see IVs running, and I didn't really get to stay for procedures, but I could see that there was a lot happening. So it kind of put me in that environment, and I thought maybe this is where I want to be. And it's funny that you mentioned wanting to be a weather girl because I was deciding at the time between nursing and journalism. So the written part of we could have been, crossing paths.
we're
Who
we're
knows?
slowly fulfilling our dreams. Oh my goodness.
But yeah, just back to the workload. I did not anticipate that much workload, and because I had roommates at the time, I had a roommate that was in social science. So she was studying anthropology, and I remember she had 15 hours of class a week. That's it. So here I am with like 20 plus hours of class plus clinical. And I was like, what is going on here? This is so unbalanced. And I felt like the whole time, really, I was just trying to keep my head above water because, like I said, I was pretty young, didn't have time to really question anything. I just did what needed to be done in order to get through nursing school, really.
Yeah, I mean, if there's one thing I could say to any of, like, the nursing students that are in school now or thinking about getting into nursing school, the struggle and the hustle is real. Like, it's just really, really wild. And I think there have been a lot of different conversations about how nursing school is, or this has been the model for a very long time. Or are there any thoughts of changing it? And I just feel like there's not any real appetite to make huge changes in terms of how the curriculum is laid out. I think there's some really important things that should be integrated. So one of the things that you actually touched on was, like one of your I guess peers was doing like social sciences, she was doing anthropology. But one of the things I found is I actually had a break in my nursing school. I had a car accident that kind of put me out of commission. I couldn't do clinical, and that's a whole other situation where you think that in nursing school that they'd be much more understanding of persons with disabilities, and in my case, way back a gazillion years ago, they weren't. So hopefully things have changed. But in my situation, they were not very helpful. So I actually had the opportunity to go back to school. Well, not go back to school. Like, instead of going back into nursing, I went to U of T and I did sociocultural and biological anthropology. And man, I think that just gave me a completely different lens on healthcare, on dealing with people. And I think that's an experience that I think a lot of young learners that are getting into healthcare miss. Like, I hear all these stories of, like, medical students that are just out of high school graduating, they're 21 years old, and they like that's their first job. Same
Mhm.
with nurses too. That's kind of scary. Like, you literally have no skills in terms of dealing with conflict, dealing with, people, understanding how people work, understanding that, there are cultural differences, respecting those differences. And I felt that break I had and that time that I spent at U of T learning about indigenous people, learning about, cultures, learning about how people interact with the world, gave me a hugely different perspective when I came back into fourth year. It was just like eye opening. So, I mean, I think there's a lot of work that should be done in terms of how the curriculum's laid out. But maybe what we should do is kind of dive in year by year in terms of what you remember your nursing school being like.
So, as I mentioned, I had moved away, right? So it was basically me trying to adapt to my new environment. And one of the first things I remember is scrambling to find my classroom, which in today's world, being virtual, that might not be an issue anymore. But I remember scrambling to find my first class. And then, of course, I arrived late and I sat down. And the professor that was leading that class said to everybody, look to your left and look to your right. These people are going to be your best friends for the next 4 years. And I was like, what? Um, Spoiler alert, that didn't happen for me. So it's not like the person that sat next to me on either side was my best friend, but these were the expectations that we were set with from the very beginning, that nursing school is going to be your life for the next 4 years. So hang on tight. I was not ready for that. And one of the things that you and I talked about was the need to buy this kit of clinical supplies
Oh
when we
yes,
first started nursing
the
school.
kit.
Tuition was pretty pricey back then. It's way more than what it used to be. But I remember having to fork out $80 for this clinical kit. I don't even remember what it was called. It was this canvas bag, and there was the word nursing in big white letters against like a navy canvas fabric. And you'd find all kinds of random stuff in there, like a catheterization kit, there'd be syringes, gauze, all of that. And it wasn't until maybe a couple months in that I realized these supplies were expired.
Yeah, so, like, I mean, oh my god, we're really letting the cat out of the bag today because, I don't think they can actually get away from not buying it. Like, you at the end of the day, like, students have to buy this kit, right? Like, I hate to say this, but, like, when we worked in a hospital, we threw that stuff out all the time. Like, do you remember going down to the, like, expired closet. It wasn't even a closet. It was literally
A
a
room.
full room full of just expired stuff, right? And like at the hospital, some hospitals had really great strategies for like repurposing some of the stuff, but like there was so much waste. And then just now thinking retrospectively, spending $100 on or $80 on a kit that, ended up like throwing all that stuff out. It's quite painful, and I'm sorry students, you're not going to get away from it, but it is quite the expense.
I feel like in the States, though, I feel like in the States, they might not have had this problem because everything's barcoded and accounted for, but in Canada, because everything's kind of covered, we don't think about these things, and so much stuff ends up in nooks and crannies to be discovered years
Yeah, I
later.
don't know. You're hitting it with the kid gloves, but I just like I just remember being like, "Oh my god, this is the worst." And we have to talk about this. Textbooks. Okay, so Sarah, let me ask you, how many nursing textbooks do you have now, like left over?
I literally have 0 because during my moves, I got rid of all of them, but at one point, I had one textbook that was so thick that I used it as a footstool. That was the only use.
Oh god. I am sure I'm walking around moving year to year with like 300 pounds of textbook. I'm not even lying. Like I just need to get rid of these books. And this is the thing. It sucks. I can't really sell them. I guess I could, but like there's new editions for like every year there was a new edition, which was it was the worst, right? Like you couldn't get rid of them fast enough. But I gotta tell you, we had a little bit of a grift, and students be out there on the grind looking for your grifts. There was a copying center. I know this is real bad, and to save money, what we used to do is we used to like copy the textbook and we would share that with one another. I know that's horrible, but like people got to survive. Like some people just don't have money to drop $800, $1,000 on textbooks every year. Some of the hidden costs that we don't recognize and we don't really account for people who are coming into these programs, right?
Well, nowadays, I feel like everything is online, but before, you were made to feel like you had to have this textbook or you were missing out on something. When in reality, I think you could have just attended all of the lectures, read all of your notes, memorized what they said, and you'd be fine without all these extra readings or recommended readings or whatever it is you call it.
Yeah, man, it really depended on your prof though, right? Because like there were some profs that I'll be honest, I just never went to those classes because they literally just read off of the slides. I was like, I don't need to be here. I could do this. I could read on my own. And then there were some profs that had nothing on their slides and they just spoke. So like
Mhm.
it was just all pictures. And if you didn't attend, like you were screwed. It was just like you miss a class and you're gonna miss something. And then there were other teachers that did like a combination of both. And then on your test, they like, here's your required reading. And now they're asking you something specifically from that text. Those teachers were like, man, there's a special place for those teachers. But again, at the end of the day, like I think about year one and it was a whirlwind. And I think, coming into university and just there was just so much going on year one for me. I don't know about you, Sarah. It just felt like it zipped by, and I think that was like anatomy, physiology, that was bed making, that was, I don't think we didn't do injections at then, but like it was all kind of like the softer skills and just I just remember it whipping by way too fast. Did you have a cadaver lab where you were?
Nope, nope,
Oh, I
nope.
did. I did. That was crazy.
What I was gonna say though is I do remember actually doing practice on injections first year, again, with
Oh, okay.
my clinical kit and an orange, had to practice giving, injections, and I remember I don't know what happened. I pushed too hard, and the needle went through the whole orange and broke, okay?
Oh my
So,
god.
let me tell you, just because you start out badly doesn't mean it's gonna end up that way. So that's highlight number 1. Highlight number 2 was studying for my anatomy and physiology midterm, and I remember doing some sort of practice test and breaking down crying because I'm like, "Why are there so many muscles in the body? Why are there so many origins and insertions, and why are there so many damn nerves?" Like the cranial nerves.
Yeah, yeah, I mean, that was wild. Like, I remember us like and there were the Oskies, right? So you kinda had the stations. You had to go station to station, and they like you might get the cranial nerve station. Like I think I'm trying to remember what I pulled. I definitely did not pull the cranial nerve station, thankfully. But like I don't know. I love the OSCEs. I found that was just a better way for me to learn hands on and kind of more of doing it than saying it. But
Mhm.
like just thinking about injections, like I don't know why I don't recall first year. You're probably absolutely right, but I just wanted to share my experience with when we got to the point where we were doing like learning about IVs and stuff. And I remember, of course, they were like, you can't do based on whatever school you went. I think each school had like different requirements that they would allow you to do. And I quite remember our organization was like, no IV starts, no like this, no that. And the nurses were like, yo, we're gonna teach you everything. We're just like, we're gonna get in trouble. And they're like, nah, it's fine. We're gonna teach you this. And I remember them saying, like, you could practice on us, you could practice on our arms. And that was one of the things that I found like they were brave. Like these nurses were so brave to be like, yeah, practice on me. And I remember one time, I don't know why, but like my husband, I think, well, it wasn't my husband at the time, my boyfriend, was dropping me off lunch. And I was like, hey, maybe I'll practice on him because he's got some really, like, the veins just like pop out of his arm. He's got, we look at those sexy, juicy, like veins. We're like, yes. And I remember I was like, I'll just practice on him. And got the tourniquet out, got him all prepped and ready. Tourniquet was on probably way too long, put the IV in, and I'm like, "Oh, I don't have a flashback. I'm worried." And he's like, "Amie." And I'm like, "Yeah." And I look at him. He's like, "The needle is like straight into my arm and I feel it like almost touching the back of my elbow." And I was just like,
Oh, no.
"Oh."
Was it at a 90-degree angle?
Yes, it was. But it was just like, and he was just calm, and I just pulled it back out, and the nurses were killing themselves laughing. It's so scary. Like, imagine, like, we're doing these things to patients, but we have to learn some way, shape, or form. But I just remember, like, I don't know about you, but I found every type of when it came to like that there may be potential harm and harm that we couldn't get away with because it's a part of procedure treatment. I just remember always being like, I don't really want to do this, but I know it was a part of my job.
Yeah, I think drawing blood and IVs is one of those things that every nurse has to go through, but for me, it's oddly satisfying to know that you've gotten the vein or get the blood, although I hate having my own blood taken. I like taking other people's blood.
I mean, eventually, like, of course, we were labor and delivery nurses, right? By the time you hit there, like, I did so many IVs. It was just something we did on every single patient, every single woman who came in had an IV, even if it was a saline lock. We all pregnant people came in, and I was just like, this is gonna happen. Like, you're getting one of these today. And we did have the rule of it was like two pokes, and then you get someone else, but
Mhm.
I'd say that for the most part, like I didn't really have very much trouble. It was really just the preeclampsia moms that were like, can't get it. And anesthesia would come, they'd fly in and just do all the hard work for us, close their eyes and just get a vein. And we're like, what the hell? But yeah, I mean, kind of year one for me was a blur, but I mean, what was year two like for you?
Year 2, I feel like was equally busy because I don't remember why, but we had an extra class that we had to take. I don't remember what the details, but they crammed like an extra class into year 2. So it was more of the same. It was like, I think I got over my anatomy and physiology, but then year 2 was pharmacology. And we had the
Yes.
most
Oh my God, the
hilarious
farm.
Oh, we had the most hilarious professors. So if there was anyone that could make it interesting, it was him. I can still hear his voice in my head. I think he tried as best he could to make it interesting, but he was one of those professors, as you mentioned, that didn't have any slides, didn't have any notes. You had to show up and you had to write down everything he said.
Oh
So
my
if you didn't
goodness.
know how something was spelled, I don't even know what we did back then. Just, write it down the best you could because it's not like Google was really that big back then.
Right,
So
right, right.
there was that pharmacology. Then my clinical rotations, I believe, were mental health and pediatrics. So mental health I actually got to do in a inpatient mental health facility, but pediatrics, they were saying, they didn't want year 2 students going into the hospital, so I ended up doing my pediatrics rotation in a daycare.
Okay,
Yeah.
that's wild. How was that?
Interesting. I feel like the only thing I really did was a lesson for kids on how to brush their teeth, but aside from that, it didn't really feel like I imagine a nursing placement would feel. I was just kind of playing with kids, like, all day.
See it's crazy, like, I was of the year where we actually had strike during our year 2, and it was a long, long strike.
Oh,
So,
yeah.
I actually had I had my PEDS placement, but it was actually, in a school, and we had, I honestly, I think it was just I feel like it was on sexual health, and I would have never imagined I feel like it was make work, if you wanna be honest.
That's how I felt with mine.
And then, I had my mental health rotation, and that was wild, and it was actually it was just there were talks of the strike that was gonna happen, and I think I had done, 2 or 3 clinical placements, but this I gotta tell this story. So I had we went and we attended groups, it was all cool, and I was learning a lot, and I think mental health nursing, I think it takes a very special type
Definitely,
of person
definitely.
to work in mental health nursing, I think about all my friends who are mental health nurses, and I think the world of them because I think that they're special people too, they have special places in my heart. Anyhow, I remember being in this group and I can't remember what specifically was a group, it was just like an outpatient mental health group. And I remember leaving and there was like a gentleman that was leaving behind me and he pulled up behind me. He's like, "Miss, miss, miss." And I turned around, I'm like, "Hey, I remember you from group." He's like, "Yeah, I was just wondering if I could talk to you." And I was like, "Sure," and I was like, "Do you have more questions about the group?" And he grabbed my badge and he looked at my first name and my last name. And this is when so student badges, they have all the deets. Like it had what you on your arm, you had your special crest from whatever school you were at. And then your badges had your first name and last name. So he just grabbed my badge and I was like, "Oh my God, he's gonna choke me." But he just was looking at the name. And he looks at my name, he's like, "Hmm." And then he's like, "I want to have babies with you." And I was like, "I beg your pardon?" I was just like, what was that?" And he's like, "Yeah, I want to have babies with you." And I was like, "Yeah, I don't know if that's appropriate." And I actually ended up having to be escorted out 2 or 3 times. And then obviously he was told that that was inappropriate. But I was like, "Oh my God, what is happening?" And then this was just this other side of nursing in terms of understanding what it is to have a patient with mental health challenges because I think sometimes you see them and you're like, "Oh, they sit in group and everything seems fine," and not understanding the pathology behind some of these, conditions and not realizing that, you know, again, I think we see mental health as something we don't see it and recognize it in the sense because it like a broken arm, you don't see it. So you don't really recognize that maybe that person's having challenges other than them coming to an outpatient group. So it was just wild that I had this interaction and then literally no clinical for 7 to 8 weeks because our school went on strike. And essentially I think we lost almost 11 weeks of school and we were all okay with it.
You
Students were just like,
survived.
"Yeah." Take that strike.
Year 2 for me, it was like I guess just to recap it, it was a lot of hard work, but I was finding my way a little bit more, so not freaking out quite so much and kinda knowing what to expect. I'm just thinking now, year 3. My year 3, I had to do a community placement, and it was basically in mental health outpatient. They called it, for survivors of mental health challenges or whatever, and, it was kinda grassroots, like, it was funded by, I think a local community group, and it was really cool. Like, it was basically drop in for people who had mental health issues so they could socialize and, do some activities. So all was good probably for the first, like, 3, 4 weeks, and then the nurse who was running it, who was also our clinical our preceptor, got into some sort of argument, and swore at everybody, and stormed out. This was in the middle of one of our yeah, one of the days we were
So
there.
crazy.
And we're like, "Oh my god." So it was me and this other nurse. There were 2 of us from the same program in there, and we're like, "Oh my god, what do we do?" Now we don't even have a point person. So she was just gone, and so for the remaining 3 weeks, we had to I think we just kinda showed up and did what we thought we were supposed to do, but really, we didn't have a nurse there because after that outburst, she got fired, and they didn't replace her during the remainder of our time. And so I never found out what happened with her, but I'm like, that was very strange. And the other thing was, the person that I was doing the placement with for my school, we used to carpool together. And I don't know if she had some underlying mental health issues, but I had asked her to do something. We were working on a project, and I was like, "Could you do your part?" And then she basically sent me a death threat over email. And when I went back to the school, they basically said, "Oh, because you didn't report it, within 24 hours, there's nothing we could do." And
That
I
is
was like,
what
"What?"
kind of weird rule is that? That doesn't even make any sense.
The person who was our, clinical instructor, I guess, the person that was with the school told me that. And I remember trying to go above her and nobody would do anything. So I just told this girl, like, "Listen, I don't feel comfortable carpooling with you anymore. So you need to find your own way."
Yikes, that is so biz and they did nothing about that?
Well, again, this was me being naive and young, and I should have pushed it harder, but I didn't. I kinda
Oh my
just let it
god.
go. Yeah.
That is that is wild. It actually brings up, oh my god, a story about because I think everyone has this experience that, you get in a clinical group, you carpool with the folks that might be in your clinical group, and actually, this person, and, her name
I
is
do.
Catherine. Yes. So we actually used to carpool together when we had clinical, and this is wild. So our first day at clinical, I actually had a blue, shiny Honda Civic car, and it was actually brand new. It was 2006, and I was picking her up to go to the oh, I was gonna say I was picking her up to go to the hospital, and I'm driving along. I have her in the car, like I picked her up now. We're heading towards this hospital, and I see this big Canadian goose like fly down in the middle of the road. And let me just say, like the we were driving in Brampton. The driving out there, I'd say it's probably gotten worse, but, like, we were driving on, like, a major street where, like, the speed limit is 70. So let's just say most people are going, like, 90 on this road. So I see this bird swoop down, and I'm like, "Oh my god, like, what the hell?" And it's kinda, like, there, just kind of, just, like, on in the middle of the road, and I was like, "Oh my god, like, I'm gonna have to swerve." So, like, I go to, like, motion out of the way, and it gets clipped by a truck. And I was like, "Oh, that's gonna save me the heartache." And then it kinda, like, didn't really fly off, and I fucking boof, like, I hit this big ass Canadian goose. It made the craziest noise, like, "Huh?" And I was like, "What?"
Maybe that was the
And
air being pushed out of its lungs by your car.
and there's, like, all like, I saw these feathers going everywhere. And I'm like, Catherine's like, kinda she like screams a little bit. And I'm like, "Oh my god." And then I look behind and it's like, not dead. So I'm like, "Oh my god." Like, I'm gonna have to like go back and try to like, put this bird out of its misery. And again, because I'm on Beauvais, so I'm on this busy street, there's trucks everywhere. And this truck just was like 18 was like, "Arr!" And just like done. And I was just like, I'm like, she's like fully shaken up. We probably said like 3 words to her other than her screaming in the car after I like decimate this bird. And then we get to the hospital. Sarah, my whole grill, the whole front of the car is covered in I don't even know what
Bird guts.
what like things was there. And I called Jordan. I'm bawling, right? I'm like, "Oh my god, I'm going to this accident, kill this bird." And like I just thought that this person, like, she was just silent after it. I'm like, I think she hates me. Like I just like first day killed this like Canadian goose. And then I was worried that I was gonna be arrested. It's like
For killing
I
a
killed a
bird.
Canadian. Well, it was a Canadian goose. They're not, you have to, like, get out of
They're not endangered, I don't think.
it was the worst. Oh my god.
Okay, this is worthy of hashtag only in Canada.
The sound, I'll never forget that sound. It was kinda like, "Help me." Oh
This is
my
so
god.
bad.
I'm sorry, Goosey.
Okay, you know what? Knock on wood, I've never hit an animal that wasn't already dead, okay? I mean, I've seen my share of roadkill in my day, but not yet, knock on wood, have I ever killed something.
Oh my god, it was just the worst because, like, I think we must have just, like, exchanged emails. We're like, "Okay, we're going to the same place, she lives very close," and that was, like, my first interaction with her, like,
Did you end up carpooling the rest of the time?
I don't know, I wanna ask Catherine, like, if we did, I can't remember, I think we carpooled maybe once or twice after that, but I think it was crazy, it was just very messed up. I totally destroyed that bird.
Oh my gosh. Okay, let's move on
4th year, let's move on to 4th year,
move on
yeah.
to 4th year. So 4th year, I don't remember much about the 1st semester, but of course I do remember my final clinical consolidation, and the way it worked in my school is that you had to rank your top 3 choices. So, of course, everybody wanted obstetrics or labor and delivery, and I did too, rank that number 1. Don't ask me how I got chosen because it clearly I don't think it was merit-based, I think they just kind of did a lottery type system because I did not by any stretch have the highest grades in my class, like, I didn't.
Okay.
But I don't know how I got it, so I'm like, "Okay, I got it," and it was, like, honestly amazing compared to the other clinical placements I'd had leading up to it. Like, I had 2 really, really great preceptors. They, were both senior nurses, but they weren't those, crotchety senior nurses, like, they actually wanted to teach, they wanted to help me learn. One of them said, "I take too much vacation," so then she had, like, a second person kind of buddy shifts, or, like, whenever she was off, like, this other person would, be my preceptor. And I saw so much. Like, I feel like they actually actively looked for things for me to experience. So after I'd seen, my first vaginal delivery, they wanted me to see C-sections, they wanted me to see stillbirths even. They wanted me to be part of high-risk births. Like, I actually even saw a couple breech births, which I don't think is very common now because there was this one obstetrician who still did them back then.
Wow.
So, I mean, like, I don't have anything really bad to say other than, yeah, it was hard, doing the night shifts and shadowing, doing full-time hours, which I was not used to, but, yeah, it was pretty good compared to what I'd seen up until that point.
So, yeah, like, I remember my 4th year and, you had that one class that everyone had to go to, and you just kind of had a final paper. It was more about, reflecting on your practice, reflecting on what you're learning, and then, again, the consolidation. I think, again, I lucked out too. I think ours was grade based, so it was based on your previous semesters to get into, like, more subspecialty. So I did choose labor and delivery specifically. And I was actually fortunate. So in year 2, I did a little stint in labor and delivery postpartum, and the same person I had then was the same person I had in 4th year. So she was amazing. I still am really good friends with her. Her name is Danielle. And yeah, my very first day we had a stillborn. I'll never forget about it because I cried like a baby. Like, I'm not even gonna lie. I remember getting to the shift, and Danielle's like, "This is the case that we have today, and this is probably the best way to get you in understanding what labor and delivery is all about." It was a full term loss, and she was who I think taught me about like how to really show that compassion, because I think you think that it's something that would come naturally. It's actually something that's learned and something that's taught, and she was just, I couldn't imagine anybody better than her in terms of how that was dealt with, how she cared for the baby, how she prepped the baby, how she spoke to the families about the baby. It was just a really good, I know, like, it's a horrible situation, but it was a really good experience to see someone like her in that role, and it was a really good model for me in terms of how I handled losses after that, in terms of, working with my patients and families. But
Mhm.
yeah, like, it was like, that was my first ever exposure, and I think it was we were kind of like the odd couple pairing because she was a very quiet, very I think you've met her, she's very
I
quiet,
have,
very kind of
yeah.
reserved and laid back, and of course, like, I'm not like that, but I don't know, it just seems like we kind of, like, mesh. I don't know, our personalities kind of mesh that way, and, yeah, so we just really jived really well, and, like, it was just I think it was like a perfect pairing. Again, she got me my job after my consolidation, and I was luckily I had her again for my orientation, but 4th year was good. I think if I think about, leading up to 4th year, did I feel fully prepared? I felt as prepared as I possibly could be. I think that consolidation really kind of seals the deal. Do I think that there are certain things that I felt could have been done differently? Absolutely. But I think that 4th year for me really kind of tied everything into place very nicely. And I think for me that was my best year. Like the year I enjoyed the most. And it's not just because of all the consolidation. I just had a lot of different experiences, and I felt that I had a different journey, right? Like I didn't do year 1, year 2, year 3, right? I had a different pathway, and I just felt that I had so much more to offer. I was more mature. I had different like I now I had a different skill set that I brought from sociocultural anthropology and from biological anthropology, and I just felt it kind of amped up or leveled up, I guess, my nursing practice. So I just enjoyed it much more than I did in all of my other years. But I mean,
Mhm.
that's just it, I think. And I remember my graduation. And I remember, because I didn't graduate with my graduating class, because obviously, like, they had gone on, and I was like, "Oh, I don't know anybody here," but they all were super like, I don't know, it was just a really good community. They were all just like, "Yeah, it doesn't matter that you weren't here. Let's celebrate together," and it was amazing. And I remember, like, us throwing our hats up, be like, "Yeah, we're nurses," and I had no idea what was coming for me.
You know, a lot of the topics that we talk about on this podcast are topics that I wish were covered in nursing school. So I've said
Right.
before that I feel like this podcast is supplemental learning to what you get in nursing school because it's very task oriented. So you learn about, the clinical aspect, you learn about all the things you need to learn about for a bedside nursing job, which is great. All of these other things that we're talking about, health equity, racism, mental health support for nurses, for some reason, it just doesn't get covered, and I don't know if
Yeah.
it's because of lack of time or because the traditional topics just kind of keep going year after year, but it's really important to kinda know, like, take a step back and realize, like, what you're doing and why. And one thing I do wanna also say about clinical placements is if you don't get your first choice, that's okay too, because that happened to a lot of my classmates, and they ended up really liking where they did their consolidation. So whether it was med surg, even occupational health, like they ended up really liking where they worked. And if they didn't, they were still able to eventually get to where they wanted to be. So it's not the be all end all. It's not going to determine your future as a nurse. Like, take this experience for what it is and learn as much as you can, I think is what I would say.
Yeah, I agree with you. Like, I mean, and it's not even about being picky. And I again, I think there's always opportunity and room to grow. And just like I would have never, Sarah, never seen myself doing what I'm doing now back then. Like it just didn't even occur to me that, nurses can be in politics. Nurses can be in journalism. Nurses could do like there's just so many different places and spaces that you could be in that I think again, just don't limit yourself. Don't be hard on yourself. Year 4 will come and go, and then you're going to be like, what the F? I have the clinical skills. Now I need the life skills. I think that's probably what you kind of were meaning in terms of like the various different aspects that we don't get that's kind of supplemental that we give in our talks. But again, I'd say it's a good foundation, but there can be some work done, and at the end of the day try to enjoy it as best as you can. It's really challenging. I have to say that, like, it is there's so much pressure and so it's so rigorous, I guess that's what they would say. And again, I think that that's another thing that we could look at in terms of making sure that, are we doing the right thing again? But at the end of the day, don't be hard on yourself. one day at a time, and you will graduate and you'll be like, "Yes, I've done this, and now I have to deal with other shit." But one day at a time.
Yeah, and don't be too hard on yourself about things like grades either, because unless you're planning to apply to graduate school, never have I been asked what my grade point average was.
Oh, on job application? Yeah, no.
Had never been asked where I went to school, just that I had my nursing license, right? So just think of it that way. And I remember at the time, everything seemed like such a big deal. But when I look back at the end of the day, it was what I learned, the people that I met, the fact that I was able to be a nurse, and then you just kind of keep learning and don't be afraid to try new things.
Yeah, I like that piece. Definitely always keep learning. I think if you stop learning, how can you continue to call yourself a nurse? Nurses are STEM. We're a STEM, and it's about continual learning, continual education, and using evidence-based practice. And that's the way that we inform our care and our care decisions. So, yeah,
Yeah.
it's not going to be that bad. You'll graduate. It'll be great.